Today's topic is about DKA, or diabetic ketoacidosis. So what is DKA essentially? Well, DKA is a complication of diabetes type 1 primarily. It's mostly seen in diabetes type 1. And grossly speaking, is hyperglycemia with metabolic acidosis. It's a dangerous condition and requires immediate hospitalization. Now, what is the definition that we can use to diagnose the condition clinically? Well, it's three things: acidosis, ketosis, and hyperglycemia. And as you can see, I've included all the criteria required to define each of these. So, what causes DKA? What are the triggers? Well, it has several triggers, such as infection, trauma, but the most common trigger is insulin medication errors. Now, all of these triggers have something in common. They cause a spike in catabolic hormones, the catecholamine groups, cortisol and glucagon. Now, the thing about these hormones is that they antagonize insulin at the cellular level, therefore oppose its effects. As a collective, these group of hormones are called counter-regulatory hormones in respect to insulin, and the key in the pathogenesis of DKA. So, talking about the pathogenesis, the main problem we see in DKA is that there's a breakdown of adipose tissue. Now, adipose tissue breakdown is normally inhibited by insulin and promoted by catecholamines. When there's less insulin, it means there's an increased breakdown of adipose tissue. So, because the insulin is blocked by these hormones and there's a deficiency, absolute deficiency in insulin, lipolysis, the rate of lipolysis increases. Now, what's so bad about lipolysis? Well, once these fats are broken down, they are broken down into fatty acids. Now, these fatty acids, for them to be made use of, have to be transported to the liver and converted into ketone bodies. As you can see, here is where the problem starts. So, because these ketone bodies are acidic, bicarbonate ions are used to buffer these ketone bodies. However, they are often overwhelmed, causing plasma pH and bicarbonate to decrease, causing the metabolic acidosis. This acidosis itself is a cause of vomiting, further leading to fluid and electrolyte loss. The acidosis also stimulates characteristic Kussmaul's respiration, which is characteristic breathing pattern. Now, the hyperglycemia in DKA exceeds the renal threshold, which means there's so much glucose in the blood that the kidneys cannot deal with it at one time, so it's excreted into the urine. Okay, and where glucose is excreted, water often follows. So this results in osmotic diuresis. Now, DKA patients often get thirsty, but because of the amount of fluid being lost, they can't drink enough to maintain the fluids required in their current state. So it's very important to place these patients on fluid resuscitation, aggressive fluid resuscitation. Now, when we combine the osmotic diuresis with the vomiting induced by acidosis, the depletion of fluid and electrolytes results in hypoperfusion of the kidney. This is essential because the kidney is the one that excretes the ketones and the hydrogen ions, maintaining sort of a balance in the body. But because the kidney is now impaired, this leads to a further exacerbation of the condition, and as you can see, there's a vicious cycle going on. So, grossly speaking, I've included general management aims, not specific management, because these are quite complicated and they are often shown in the guidelines. But just for a general idea, 3 targets you want to do. So you want to hydrate the patients, and this will counter the effects of those counter-regulatory hormones, and most importantly, prevent the kidney from being hypoperfused, which would kind of block that vicious cycle that I was just talking about. And secondly is to give insulin as much as you can, stat dose. I've included values in here, and this will prevent the ketone production from occurring, as insulin will block the breakdown of the fatty acids. Now, in the case of triggers eliciting the DKA, they should be dealt with, such as in the case of an infection causing DKA, that infection should be treated as well as these other measures. So that was a short video on DKA. If you have any questions or queries, please leave them in the comment section. Thank you.